This program has been made especially for you, people who work in Australian government subsidised aged care services. The people in your care depend on you, which is why, if they have any concerns, they will often come to you first. So whatever your role is, the aged care complaints process is a most important topic. In this program, we will talk about what you should do if someone does raise a concern, and we'll also learn about the Australian Government's strengthened aged care complaints scheme. This presentation has been organised in segments so that you can pause and revisit each topic if you need to. The first thing to discuss is why listening to and responding to complaints is important.
As people who work in aged care, you have an important part and an active role to play in hearing and receiving the concerns of older Australians. So please remember, complaints should be seen as positive and are important to help improve the quality of Australia's aged care services. Older Australians have a right to express their concerns and have them dealt with respectfully.
The biggest reason to see it as a positive is this is about the care you deliver. And if you want to deliver the best possible care, then you need to listen. And let's face it, every single staff member that works in aged care is there because they care.
There is enormous goodwill, and that needs to be reinforced in all the messages that organisations like COTA and the unions and anybody who's involved in aged care needs to keep putting that we're all working together to provide good quality care.
So if there are concerns that you feel you can't deal with, your management can help with that as well. And also management need to hear about what you see on the ground.
We know with dealing with issues or concerns that families and residents and people in their own home often feel most comfortable to talk to the people that they deal with on a day-to-day basis. And so if it's a nurse or a personal carer or maybe even a cook or a cleaner, families and residents and consumers have an interaction with those people. And so not surprisingly, they're the people that they'll often go to first. And so it's a great thing to listen to those concerns, and if I'm a frontline staff member and a family member or a consumer raises an issue, make sure that in your organisation you take that to the right place at the right time as quickly as possible.
So if you're working in an aged care facility or for an aged care service provider and somebody makes a complaint to you, the best way of taking that forward is to take it up within the management stream of your aged care service provider. So whether it relates to the quality of care that you're providing or the quality of care that somebody else in the service is providing or what the service is doing as a whole, escalating that within your management structure is the best way to get resolution of that.
To summarise, when anyone shares a concern with you about the aged care services being provided, remember, try first to resolve the issue through your service's internal complaints process. This can deliver a faster, sustainable outcome for care recipients without the need for further action. When concerns are raised, the most important thing is to work towards a resolution in a calm, methodical way.
The key thing with resolving any concerns or complaints is to be open, engaging and transparent in everything that you do. It's very easy to feel defensive that people are taking umbrage at something that you have done directly. So what we look at is keeping an open mind about where these concerns have come from.
There are techniques for working through concerns, getting to the heart of the matter and finding a solution. First, you must establish exactly what the concerns are. Break them down into separate issues if necessary to find out what is really going on. Other techniques include active listening. It means giving the person who is talking to you feedback by restating what they have said. This makes sure that you have understood their message. Focus on outcomes rather than on who may be right or wrong. Actively involve the care recipient and make sure you talk to everyone who needs to be involved. If the concern is about food, for example, make sure you talk to the catering staff and work with everyone to achieve a mutual outcome. Ensure that the solution you reach is agreed to and understood by everyone.
As Australia's Ambassador for Ageing, I'm a strong advocate of the right of all older Australians to healthy and active ageing, whether they choose to stay in their own homes or move into residential aged care. Where older Australians have any concerns about the quality of their care, I believe in the importance of supporting them to speak up, because everyone has a right to make a complaint without fear. People aren't always comfortable about raising concerns they have, but they should be. This is why you are so important. As an aged care worker, there are a number of ways in which you can make care recipients and their family and friends feel more comfortable about expressing their concerns. Advocates can support anyone who doesn't feel comfortable raising a concern on their own. The National Aged Care Advocacy line is 1800 700 600. Despite your efforts, some concerns may not be resolved within your service. In this case, the Aged Care Complaints Scheme may be able to help. Everyone has the right to submit a complaint to the scheme confidentially or anonymously.
The Aged Care Complaints Scheme is a free scheme that's available to anybody who wishes to make a complaint about the care that somebody is receiving in Australian government subsidised aged care. The Commonwealth will still be expecting the service provider to resolve complaints in the first instance wherever possible.
One of the really positive things that's occurred in the last few years is that the way the departments listened to the feedback about the need to restructure the complaint scheme. And what they did is put in place a system where individual consumers could raise issues at a local level and allow us to try to resolve those issues with the people concerned. That's definitely the way to approach a feedback and a complaint system. One of the things that I'm sure we'll find as we reflect on the new complaint scheme as it rolls out over time is that the majority of issues, and probably in my view, hopefully the vast majority, are going to get resolved at a local level.
In some cases we will be investigating complaints, but in many cases we'll use the other resolution techniques that we have available. So we might be resolving a complaint just through a series of phone calls between us and the complainant and us and the service provider. We might refer a complaint to the service provider for them to resolve, so it puts them in the driving seat in terms of reaching a solution with the complainant.
And what we're really looking for is what's reasonable in the circumstance as well. We don't take sides, we just look at what's best for the person.
It's important that as an aged care worker, you understand your responsibilities to report any missing residents or allegations or suspicions of physical or sexual assault to your manager as soon as you are able. For more information about this, please refer to the compulsory reporting blog posts on the Aged Care Complaint Scheme's website. There are scheme resources available that can help you, including a brochure, a booklet, posters and fact sheets. The scheme website provides useful industry resources, including an online toolkit that has been designed for aged care staff to support them in effective complaints management. This industry toolkit includes short alerts and longer reports that outline and identify an issue, trend or risk, and give suggestions of areas that aged care providers may wish to review within their service. By visiting the website, you can also provide the scheme with feedback and request further information about the posted topics. Subscribe to the website to receive the latest updates. If you, your care recipients, or their family and friends need more information, contact the Aged Care Complaint Scheme by phoning 1800 550 552. An interpreter service is also available for anyone who may need it. Simply tell us when you call and we will arrange to use the translating and interpreting service. Alternatively, you can call the translating and interpreting service directly on 131 450 and ask them to put you through to the Aged Care Complaint Scheme on 1800 550 552. For anyone who is deaf or has a hearing or speech impairment, we can also help through the National Relay Service. Call 1800 555 677 and ask for the Aged Care Complaint Scheme on 1800 550 552. You can also write to us at Aged Care Complaint Scheme, Department of Health and Ageing, GPO Box 9848 in your capital city, or visit us online at agedcarecomplaints.govspace.gov.au.